For me, it's important to provide good care to LGBTQ patients into the community because it's a community that I'm part of myself, and it's one that is disproportionately impacted by a lot of healthcare needs. LGBTQ patients face higher rates of chronic illnesses as well as are known to die earlier as a result of these conditions. So it's very important for us to be sensitive to those needs. First and foremost, we provide LGBTQ culturally competent and affirming care. We have providers that are trained specifically in caring for members of the community, and that's basically all we do. So when a patient comes here, they know that they're going to have someone who understands their health needs. One of the things we've been working to expand access to is pre-exposure prophylaxis and post-exposure prophylaxis for HIV. The way that we're planning on doing this is by launching a website that patients can go to where they can fill out a form, speak with a pharmacist, and get the PrEP mailed to them in their own home without having to deal with an office visit or co-pays or a lot of the barriers that prevent patients from being able to get that care. Really, anyone who's sexually active and is having partners who they don't know their HIV status or could potentially be positive would potentially benefit from being on PrEP or having access to PrEP. For patients who want to find a LGBTQ culturally competent provider, if they go on the Intermountain's Find a Doctor page, we have a filter where patients can go and tag, is this person LGBTQ competent? And that will display a list of providers who are. For patients who are farther out in the state and might not be in the Salt Lake area, if they want to get primary care and it would be too far for them to drive up, for example, for a patient in St. George, we do offer telehealth visits so that patients can see us remotely and get the care that they need. People within the LGBTQ community have unique preventative needs like vaccines, and seeking care with a provider who's not necessarily trained or culturally competent in LGBTQ care may result in people getting these missed. Like you mentioned, the Mpox vaccine was something that was more prevalent in the past, but also there's possibility that we get another wave this summer. So it's still something we're encouraging for patients. It's very important to me personally to help people because this is a preventable thing that we can be helping people live longer, healthier lives. And it's something that's so easy to do well if we just do our best at it.